Let go. Hey, Mr. Jones, how are you? My name is Alondra, and I'm going to be taking care of you today. So I have provided privacy, perform hand hygiene. May I have your first and last name and your date of birth, please? Okay, and I'm going to go ahead and check your pulse socks. And so what I'm going to be doing today is I'm going to be inserting an NG tube, and it is going to go through your nose to the back of your throat all the way down to your stomach. Now, have you had any recent, first, do you have any allergies? No? Any pain? No? Okay, and have you had any nose surgeries?
No.
Broken nose? No?
No.
Okay. So, let me just check your stomach real fast and make sure it's okay. Okay, so everything looks fine, and I'm going to place this, and this is going to be very uncomfortable, but it's going to help release some of the fluids in your stomach. Okay, so the pulse ox is good. I'll do vital signs and everything first. Okay, so let me put my gloves on. So I'm going to ask you to swallow some water for me to make sure, so that I can check your gag reflex. Here we go. Okay. So I've done that. Also, would you mind coughing for me? So I would give him a tissue and he would cough for me, and I'd make sure that he can. Okay. So the bed is up, and I have my tape ready. Have my gloves on. And I'm going to go ahead and check this to make sure that it's working. So we do it on regular and we turn it to intermediate afterwards. Okay, and it is working. So I'm going to go ahead and turn it off. Also, I will check this one to make sure that this works, and we'll pour 30 milliliters of normal saline into our container and check to make sure that it does work, which I already have done, and it does work. So now I'm going to measure, from the tip of his nose to the back of his ear, and then to his xiphoid process, which is right here. And I will mark it with a piece of tape. Okay, so that I know how far I have to go down. Okay, and so before I do anything, I'm going to I'll pull back 30 cc's of air, so in case there's like a burst of fluid, it'll catch here and not onto me. Okay, so that is ready. I have my water here. So, okay, next I have my lubricant right here, and I'm not going to actually open it, but I would open this, and then it's only like the top of the tube, like 4 centimeters is what I'll be doing. So, and I'll just place some of this on here, and then I'll be ready to go. So, like I said, this is very uncomfortable, and first I'm going to have you with your head back, and so I'll make sure that once I go in, once it goes through the nasopharyngeal and I see the tube in the back of his throat, I'll have him flex his head down to his chin. So I'm going to go ahead and start, okay? First, I'm going to occlude this nostril and have you breathe out of that one, okay? Because I'm checking for patency. And then the same thing on this side. Okay, so I'm going to do your right nostril, and like I said, very uncomfortable, but here we go. So his head back, and once I see it in the back of his throat, which I do, he'll lift his head up. Okay, and I have made it to my tape, and I will quickly just check the back of his throat to make sure that the tube is there, and it is. Now I'm going to place tape on here. So make sure it is secure before I listen to his stomach. So tape and gloves do not work very well. And just go tape around. And I'll do the same thing with the other side. Okay, and then I'll place some more tape on there to make sure that it is secure because we need it to be secure. Not directly. Okay, so now that it is secure, let's see. I'm going to push some air into, but first I have to listen. I'll listen while I do this. So that is secure. And I should be able to hear a noise when I put some air in. Okay, which I do. And so then to make sure for me to check to see if I am in the correct spot, I'm going to pull back. And if there's green fluid, I know that I'm in the correct spot, which for him, let's say there is green fluid, and I'll push it back in. Okay, so I'm now done with this procedure. So I'll remove this. And if I was to check for pH, I would remove some of this, put it in here, and then check the pH for it. But for the video purpose, this is what we're doing. So I'll remove this, connect it to my suction. So first, we'll have it on regular so that it can take the fluids out, and then after a minute or two, we'll turn it to intermittent, and then we'll leave it on that one. And so then it would be working. So we'll leave it on intermittent. So that is how to insert it. And now to remove. So if I was to do formula, I would check it, prepare it, check the expiration, make sure it's room temperature. I would shake it, fill the bag with formula, set the pump appropriately according to the orders. But for video purposes, this is all that we're doing. And I would label it. So, okay. And then let's see. So that's what I would do for this one. Okay. So now I'm going to remove it, and I would verify the orders to make sure that I have to remove it for him. So first I will turn the suctioning off. Okay. And I will disconnect this. First I'm going to remove the tape. So do it very slowly. Okay, and this is going to be uncomfortable as well, but once it is out, it is out. So I just pull it back slowly and have it in my hand, disconnect it, and I will throw this away and make sure I remove all of this, and I am done.